Hi, my name is Briana Scott, and I'm a post-licensure BSN student at Sonoma State University. This video will be my exit interview statement in which I'd like to encourage my colleagues and fellow nurses to pursue a bachelor's degree in nursing. First, I'd like to address the reasons why I believe obtaining a bachelor's degree is important, and then discuss how I was personally able to maintain balance between life, school, and work. First, I'd like to discuss how this program has helped me advance personally and professionally. Sonoma State's program has a strong foundation of evidence-based research as part of their curriculum. I found this to be one of the most important factors of the BSN education that I was able to implement in my career. For example, in the first semester, I participated in a group research project on the topic of sepsis. During this project, my hospital was also rolling out sepsis protocols during the exact same time in the fall of 2014. We, in our research project, were researching different nursing interventions for sepsis and how these benefit patients. And then I was finding at my work that I was putting these things into practice. And what I was appreciative of was the fact that this research was directly applicable to my career, and it helped me grow as a nurse who was able to benefit my patients. I believe that the topic of evidence-based research is beneficial for the nurse because you're able to expand your mind. You learn more about the things you're practicing, and it benefits your patients. Most importantly, it saves lives. Evidence-based research for me was a big reason why I felt that the BSN was beneficial for my career. Second, we participated in public health clinicals in the first semester for me. And I felt that this really helped me grow in the areas of cultural competency, social justice, and patient advocacy. Public health is something I didn't know anything about prior to this education. And what I learned during this experience is that nurses really don't have control over patient care situations. And a competent nurse is one who's able to recognize situations, recognize differences, know their own biases, and work from a neutral place. And what I learned in my public health clinicals is how to be understanding and how to advocate for people who may be different than me, um, and how to provide culturally sensitive care for people who really have a different understanding about health than I do. During my education at Sonoma State, this is something that I was implementing on a weekly basis at work and in my career. And I also feel that it helped me grow personally. It helped me grow personally because it just expanded my mind and my ability to connect with people of different backgrounds and people who might have different ideas than I do. So those are two big reasons why I feel any nurse would be able to benefit personally and professionally from a BSN education. For me, those were the two topics that were most beneficial, but the list could go on and on. Those are the ones I chose for this video. Second, I would like to talk about how I was able to balance life, school, and work. I will say that in the beginning of this program, I was feeling like there's absolutely no way I'm going to be able to get this done because I was a full-time nurse working 12-hour shifts. But what I found, especially with Sonoma State's program, is that I was able to put aside one day a week, get online and get my homework courses completed, get my homework completed, all in one day. And what I found is, at first, this was difficult because I was used to having 4 days off a week and I wanted to do what I wanted to do with my time. However, my turning point was when I realized that schooling is a way to improve myself personally and professionally. Therefore, it serves as a means to progress in my life and in my career. And I think this rings true, especially the examples I mentioned earlier, where what I've learned in my schooling and my research and my experiences with public health have helped me grow personally and have helped me grow professionally. And once I was able to realize the benefits of for my personal life, it became a lot easier to balance life and school and work. I just dedicated one day a week to my homework, and although it wasn't super fun, it was beneficial, and it was really showing when I was on the floor working as a nurse, and it was showing in my personal life, in my interactions with people in my community. So, in conclusion, I feel that the skills learned during this program, namely the implementation of evidence based research and my growth in the areas of cultural competency, patient advocacy, and social justice, have fueled a desire to continue lifelong learning. The skills I was able to implement in the balancing of school, life, and work will help me create time and space to focus on furthering my learning, which in turn will make my nursing practice more beneficial for myself, my employer, and most importantly, my patients. Because in the end, it's about taking care of people um, in a safe way that's going to benefit them and benefit you. Thank you.